Hello everyone. So let us start with the first topic, that is skin abscess. So I am pretty sure all of us who are watching this video might have faced this issue sometime or the another in our life, especially when we use the razors or we use some epilators. Yes, so we can have these abscess after that, right? So let us discuss about this condition, having skin abscess, and as we go ahead we'll discuss different types of abscess as well. Yes, so the first one is, let us see what is the most common organism which causes the abscess. Yes, so I know this is the organism which we all listen about a million times, that is the Staph aureus. Yes, so that is the one. It's caused by Staph aureus. Okay, this is an infection by Staph aureus. Okay, this one. Okay, so the next one we have a carbuncle. As you can see, this is very angry looking, yes, abscess, which at the sides, as you can see, we can clearly appreciate that there are these small pustules, yes, which are there. So how would we describe them? As these are the collection of boils, right, which are the collection of hair follicles, right, inflamed hair follicles, inflamed hair follicles. Okay, so that is the reason we have this carbuncle. Okay, and most of the abscess usually that's the reason, right? Maybe there is the blockage of the apocrine glands. Yes, maybe the sweat glands are blocked. That is the reason we could have this. The next type of abscess we have is 𝗲𝗵𝗵𝗵𝗵 𝗵𝗵𝗵𝗵. All right, so this usually happens under the arms, that is right here you can see 𝗲𝗵𝗵𝗵𝗵𝗵. This usually happens when there is a blockage, right, of the apocrine sweat glands. So maybe this lady was using some sort of roll-on, yes, which caused the blockage of the sweat glands, right? So which lead to this. The name should be very clearly memorized, that is 𝗲𝗵𝗵𝗵𝗵𝗵. All right, so and that is the image for it. Yes, so there is recurrent abscess formation in the axilla, groin and perineum that results from chronic follicular occlusions, right? Chronic follicular occlusions and inflammations of the apocrine gland. This is from chronic follicular occlusions and inflammations of apocrine glands. Okay, all right, so and it can be also be associated with some metabolic disorders such as diabetes or obesity. Okay, so let us see about the general presentation of the abscess, right? So I have drawn the diagram. Okay, as you can see, I guess let us just take this third point first. Yes, that is the flocculent. Yes, so it is the flocculent test is positive. It means that if there is an abscess and if push it from one side, yes, so because there is pus, yes, there is pus in it, so what is going to happen is going to shift towards the other side. Yes, and that is the reason we should test this with 2 fingers, not with one, so that we can feel it, because if the abscess is deep, we can feel it from both the ends. Okay, all right, so this is flocculent test is positive. Okay, so all the abscesses we read in all the medicine, the first treatment is going to be incision and drainage, and for sure we will give antibiotics to the patients before performing this, so that we can reduce the size and the aggressiveness of the abscess. Okay, all right, so now comes a very, I would say, interesting point, that is the complications. We read abscess, we think, okay, fine, you know, nothing much complicated can happen because of the abscess. Yes, but not in this case. Let us discuss this point. Complications of skin abscess, if there are facial abscess. Yes, so what can happen is, if it is not being taken care of, what's going to happen, because through the veins, right? Because the facial veins are valveless, this abscess can travel back towards the and cause cavernous sinus thrombosis. Okay, alright, so this is an anatomy link. Yes, it can cause a cavernous sinus thrombosis as well. Okay, so this is the vein, the facial vein. Okay, and over here you can see in the next diagram, that is, if there is some infection here or here, it can straight away go towards the back and we can have a very serious complications. That is cavernous sinus thrombosis. Yes, we can see, and this is a diagram for the cavernous sinus thrombosis, and this is a diagram of a cavernous sinus and the contents. Okay, so I have made a list below this diagram as well, so let us just try to label them one by one. Okay, so the first one over here is the oculomotor nerve. Yes, and the next one is ophthalmic. Ophthalmic nerve, and the bottom one is the maxillary. Yes, and the one on at the bottom, this is the abducent, and this is the trochlear nerve. Alright, so this is trochlear nerve, and so this abscess, if untreated, the facial abscess if they are untreated, it can cause a cavernous sinus thrombosis. Yes, and let us take this opportunity and just revise the contents of cavernous sinus. Okay, I have listed all the contents here and the diagram is there as well, so let us just try to label them. Okay, so the first one is the oculomotor nerve, and this is ophthalmic, and this is maxillary, yes, and the one right here, this is the abducent, nerve, and right here this is the trochlear. And what is this? This one is the internal carotid artery, right? Yes, internal carotid artery. Okay, fine. And all these I mentioned here as well. The contents of cavernous sinus. These are the internal carotid artery, oculomotor nerve, trochlear, ophthalmic nerve, maxillary, and the abducent. Okay, so this is all about the skin abscess. I hope I did some justice to this topic. Thank you for listening. Have a great day.